Welcome back to Daniel Ultrasound Clinic. Lady patient complaining of bleeding per vagina, BPV. So she has a history of infertility with recurrent abortions. Now she came to my clinic for the bleeding per vagina. On ultrasound of pelvis, here we have got special findings I would like to share with you guys. This is uterus. You see here, it measures approximately 9.7 into 4 into 5.5 centimeters. This is uterine outline. This is urinary bladder here, hypoechogenic structure. But a special thing here is to note is here is the solid mass with highly echogenic borders, and this mass is causing a bump into the posterior urinary bladder wall or indenting the posterior urinary bladder wall. This is fibroid, which is causing a bump in the posterior urinary bladder wall. Here it is. The margins are not usually highly echogenic, but maybe due to the calcification process. So this is a fibroid measuring approximately 2.6 into 2.5 centimeters. So this is located, now the location of the fibroid is the anterior part of the myometrium region. So there are many types of fibroids. I have described somewhere else in the pelvic pathologies like intramural, submucosal, and subserosal. So this is intramural. This is intramural fibroid, which is causing bump in the posterior urinary bladder wall. Again and again, I am telling you. So this may be the cause of recurrent abortions, as the patient tells us. And this is urinary bladder longitudinal section. Now let's go to the ovaries. This is right ovary here. It's normal in size and shape. And this is left ovary. This is also normal. So the main thing I would share with you is the cause of bleeding per vagina. But this bleeding is heavy but regular on regular basis. Fibroids usually cause heavy bleedings, heavy bleeding per vagina. Less likely they cause irregular bleedings. So this is the pelvic pathology. Very special thing to note here. Again, I am taking its good shot. Thank you very much.